her patients before they were in the medical emergency. That was when she established her wellness clinic in Laguna Beach, which she appropriately named Wellness, Longevity, and Aesthetics, where she practices functional medicine. Because she decided late in life to have a family prior to having her family, she made sure she had adventures in her life like climbing Kilimanjaro during the Annapurna circuit in Nepal and cycling around the world, just to name a few. Ladies and gentlemen, Miss Anita Wang.
Thank you. All right.
Dr. Anita, we're going to record you.
Okay. Yep. So I just recently, my sons are graduated from high school and they're heading off. And so they wanted a graduation trip, which was to Greece. So that's where we went. Alex on the left is going to Michigan State. His younger brother by 2 minutes, Zachary, is going to Manchester and the UK. So I'll be an empty nester by October. Anyway, so what I want to talk about is longevity, because that is really what I saw. And I got that idea is really from seeing my father and seeing what's going on in the ER. And being very invasive in the ER, I wanted to be non-invasive in my office. So I have the very non-invasive approach. And the idea of longevity is that in conventional medicine, they say you're born, you're vital, and you decline. Functional medicine, we say you're born, you're vital, and you maintain. And what I really try to do is maintain people as you go along your chronological age. So you stay at the age of 30, where that was pretty much your peak, and you start to have that decline. So to me, the decline is actually aging. And what people used to think is that how you were born, what was in your family, what was your genetics, that is your destiny. There's cancer in my family. I'm going to I'll probably have cancer, or I'll have diabetes, or I'll have high blood pressure. But that's not true. In the last 30 years, there's been epigenetics. Epigenetics is that we have the influence onto our DNA. So 25% is genetics. So that's why I like to test your genetics, know your blueprint, know what the cards are that you were dealt. And then 75% is your lifestyle. So managing and helping people change their lifestyle and understanding what that is and how that affects you. And so that is the basis of that. And then what I would see in the ER, which is to me, the human body is so amazing. So I had this patient that came in. He was a homeless guy. I see a lot of homeless people. And he had pus coming out of the ear, just having pain and everything. Had a CT scan done, and there was a knife blade in his ear. So he says, I don't know, I was sleeping, I woke up, and I have this pain in my ear. Well, yeah, something happened. He got stabbed, and part of the blade stayed in there. So because we're a small hospital, we had to send it to a larger hospital to have him surgery. Well, he's homeless. He had to go get a fix or something because he needed a little bit more pain medicines or whatever he needed. So he left to go do whatever. Didn't have the surgery done. Comes back to my ER now, months later now. So he's homeless. He's got a hard life. He doesn't eat well. He eats processed food. He's eating garbage, right? He's not sleeping well. He's not doing all the things that we should be doing. But this body keeps on ticking. And he's got this thing in his ear. So now he's got pus coming out of his ear. He's got this eye bulging out. Now he's blind. So now I'm trying to send him to another hospital. He's been denied. I don't know what happened because I signed him out to the next person. I have to ask what happened, where he ended up getting transferred. But we couldn't get him in Orange County. We couldn't get him in LA County. And then when I signed him out, I said they were trying for San Diego County. So I don't know what happened with him. But to me, that is the body. You abuse it, and it just keeps going because it wants to be healthy. So it's what you do. Us, we abuse it, and yeah, you're going to live a long life, you're going to live whatever, but it's not going to be the ultimate that it could be. I want to get to the next level where you can have the ultimate health and know what you can do and how you can, what you can do with that. So, and that's going to be, most people will end up waiting till their skin is sagging and say, oh, I need a facelift, or I had a heart attack. And then that's when they're going to make that change. And I want to have people have that epiphany before, so we can make that change beforehand and be proactive and prevent that. So what I always talk about is the mitochondrion. So the fountain of youth to me is monitoring your mitochondrion, knowing your cellular function. What is that and what happens in there? Well, we'll talk about those. So these are some of the things that you need to do, and VO2 max and keeping your muscles. Those are probably the three measures that I like to monitor. And the cellular function is that basically you have senescent cells. So what happens with your mitochondrion? things start to die off. Your blood cells, you have new blood cells every 120 days. So, but sometimes they just stop dividing, and then they just sit around. They become zombie cells. They become senescent cells that just gunk up the work. And autophagy is that cleanup. So you want things to get cleaned up, and then sirtuins are those things that help you prolong and build up and clean things up and control inflammation and repair your DNA. How much time do I have? Okay. And then some of the things that we talk about, so like some of the things that Sandy gives you, are senolytic supplements that actually help you to clean out your sirtuins, get rid of those, support your sirtuins and get rid of the senescent cells, the zombie cells. And then how to activate the cellular is by the things that you hear all around. So just knowing why are people talking about that. So intermittent fasting is one. Exercising is one, right? NAD is really important because your mitochondria is making energy. So people want to get the energy. So you always have to take your B vitamins, your green leafy vegetables that helps you build up make energy so that you have a lot throughout your life, right? So sleep and your vagal support and all of that. So this is why NAD is, so you have this, the Krebs cycle, and the Krebs cycle makes you get NAD and you make your ATPs and you have your energy. When that whole system is not getting the cofactors that you need, like the B vitamins, antioxidants, some minerals and things like that, you don't have as much energy. So that's the decline. So I monitor that by testing that. That's not what the regular conventional doctors do. They look to see your blood work. Oh, you don't have disease. I'm looking to see how well is it actually functioning. So, and then things that you can do to boost it: fasting, exercise, cold plunges, supplementation, things like that. That's just all the same thing. It's the things to avoid: a lot of alcohol, a lot of sugar, if you're not resting, things like that. So inflammation is one of the big key things that creates problems. So that's why I talk about anti-inflammatory, what kind of diet you're talking about, heart disease, Alzheimer's, all of that stuff is cancer is all related to how much inflammation we have in our body. So you want to eat an anti-inflammatory diet. You want to get your omega-3s, your turmeric. You want to sleep well. Sleep is one of the hugest dynamic process that's happening. It's just not a passive thing where you just turn out the lights and you're gone. It's actually cleaning up. There's so much work that's going on. So you have to get clean, deep, restorative sleep. Managing your stress, having the gut-brain axis and making sure your gut is healthy. So all of these things that we talk about are all the little nuances, but you need to know how you're functioning and what you're doing. So how do all of those things affect you? You have to have the metabolic flexibility and hormone balance. So it's like a hybrid. You got to be able to turn on burning off carbs or burning off fat. And so you got to be able to have that metabolic flexibility. Yeah, but if you don't, then you have insulin resistance and you have a poor detox system. You want to work out with, Regina, because you need that strength training. You want to, walk after you've had a good meal. Again, this says intermittent fasting. And the things I like to do is do the continuous glucose monitoring to see how your food is affecting you. Somebody could eat watermelon and it actually shoots your blood sugars high. So that's a bad thing. In Chinese medicine, we call it extra heat, so we don't want that. I do a lot of hormone testing with Dutch test, which is through urine, which is different than what the conventional medicines do. They do it with blood, which it's not as good. Anyway, so longevity for your brain. We call it Alzheimer is the type 3 diabetes, so we're going to monitor those. You want to do stimulation of your brain, a red light therapy, and nutrients, and the things that non-invasive for me. So if you go to HYPE therapy, you get the cold plunge, you get the sauna, you get the red light, you get the hyperbarics. I have vagal stimulation tools also that if you aren't good at meditating or zoning out or getting your sleep, there's actually tools that can actually help you stimulate the vagus nerve. But the one that I have is the M-Sculpt Neo, which is to me what I said, the three things that for longevity is your VO2 max, which is your cardio fitness and your mitochondrion and your muscle. So the M-Sculpt to me is one of that. It improves your metabolic and improves your muscles and help as part of a longevity tool that I use. So final takeaway that I say is basically know how your body naturally works. What is the cards that you are dealt with? Support your cells, your gut, your brain, metabolism. I do it non-invasively, get to the root bottom before you actually have that event. And age and strength with strength, clarity, and vitality without severe biohacking and surgery. And of course, partner with your favorite functional medicine expert and learn how to play and win with the genetics and lifestyle cards you've been dealt with. Here's to your health. That is it.
Any questions for Dr. Anita?
Yeah.
You had a question about biohacking. What is biohacking?
Biohacking is what people talk about is how to stimulate your body. So hormesis is actually stress on the mitochondria. So like cryotherapy could be a biohacking. Working out in zone 2. So actually knowing what works for you. How long do you fast? So all those tools that you hear about people talking about health and all that is kind of like biohacking, hacking into your system and know what's going to stimulate your metabolism to make you live long and have a healthy body. So just little tools.
So you see all these drinks on TV or Costco or whatever, the oxyberry, the antioxidants. Does that stuff really work?
Diet is key, right? What is actually the most important thing is you have the NFR2 system in your body, which is your antioxidant system. So there's 3. There's glutathione, there's catalase, and there's SOD. Those 3 are in your body, and as we age, they start to decline. Okay, but those are what are fighting off the free radicals. So we need to support them. So as those die off, your diet really makes a difference because the more blueberries and dark cherries that you eat, as long as your sugar is low, then you're adding to the antioxidants that your mitochondria needs that runs in the Krebs cycle that produces the energy. So yeah, they can be helpful, but you have to be careful. Are they organic? What is their source? Are they clean? What other things do they have in them? So that's why Arbonne's a good product because it's a clean product, right? So you want to make sure that the source is good and what is going on with it. So because they're not all built the same. Yeah. That's it.
Like, what degrees does water have to be at when you do the plunge? Like, what is, is plunging so good for you?
Well, it's good for inflammation. It's good to stress. It depends. To me, I don't know the exact temperature. So all of those, they have different ones and depending on how long you be, right? To me, it doesn't matter as long as you are stimulating. I use heat. I prefer heat, so I'll stimulate mine with heat. And occasionally I'll go in a cold plunge. It's not going to be as cold as some of those cryo places. So I go into a Korean spa, which has a cold plunge, and I can sit in there for 20 minutes. Probably it's not like the cryo freeze that you're going to go into, which you're going to have decreased immediate anti-inflammatory processes, but it's just how you're stressing the body. So it's just like, I think everybody knows when you are kind of just like at work and it's kind of a slow day and it's just like, or you're at a restaurant and it's just like going along, you're just not on top of it. Things kind of ball gets dropped. But then when there's a little stress and you're like extra little go and things and you're just catching it. Now there's over stress and then you screw up and there's under stimulation. But when you get that right stimulation, things are humming and blowing. That's what we want to do with the mitochondria. And that's all what that's all about, is finding that biohacking that's right for you, that stimulates your mitochondria and your system to be right in the zone all the time.
Okay. Thank you, Dr. Anita.